Hello doctors, today we begin the practical training of wet cupping therapy. Chapter 1. Patient Assessment and Consultation for Wet Cupping, Hijama. Learning Objectives. By the end of this chapter, you will be able to conduct a proper patient consultation, identify suitable and unsuitable candidates for wet cupping, recognize contraindications and precautions, obtain informed consent, create a treatment plan. 1. Importance of patient assessment. Patient assessment is the most important step before performing wet cupping. A good assessment helps to improve patient safety, reduce complications, select appropriate cupping points, determine whether wet cupping is suitable for the patient. Rule: never perform wet cupping without proper assessment. 2. Patient registration. Collect the following information. Take screenshot of this page. Medical history. Ask if patient is taking blood thinners. Examples: warfarin, apixaban, rivaroxaban, other medicines, steroids, contraindicated, painkillers, diabetes medicines. Patients using blood-thinning medicines require extra caution and medical clearance when appropriate, or stop at least 5 days before. 3. Contraindication. Screening absolute. Contraindications: do not perform wet cupping if active severe bleeding disorder, hemophilia, severe anemia, active skin infection at treatment site, severe uncontrolled medical emergency, patient refuses consent. Vasovagal reaction screening, very important. Before performing wet cupping, every patient should be screened for fear, anxiety, and previous fainting episodes. Some patients may develop a vasovagal reaction due to fear of blood, fear of needles or blades, pain, sensitivity, anxiety and stress, seeing blood during the procedure. A vasovagal reaction can cause dizziness, sweating, nausea, weakness, drop in blood pressure, temporary loss of consciousness, fainting. Mandatory screening questions. Ask every patient. Fear assessment 1. Do you feel uncomfortable when seeing blood? 2. Are you afraid of needles, injections, or blades? 3. Do you become anxious before medical procedures? 4. Do you have a very low pain tolerance? Previous episodes 1. Have you ever felt dizzy after an injection or blood test? 2. Have you ever fainted during or after a medical procedure? 3. Have you ever fainted after seeing blood? 4. Has any doctor or healthcare provider told you that you experienced a vasovagal episode? Neurological history 1. Have you ever had seizures or epilepsy? 2. Are you currently taking medicines for seizures? 3. Have you ever lost consciousness for an unknown reason? Precautions for high-risk patients. Do not perform the procedure while the patient is sitting upright. Prefer a lying down, supine or prone position. Keep the patient under observation. Ensure proper hydration. Avoid showing blood unnecessarily. Communicate calmly throughout the procedure. Have emergency supplies available. Clinical tip. If a patient says, मुझे इंजेक्शन देखकर चक्कर आते हैं और ब्लड देखकर घबराहट होती है, do not ignore this information. Such patients have a higher risk of vasovagal syncope and should be managed with additional precautions before starting wet cupping. Caution. Patients with a history of vasovagal syncope, severe blood/needle phobia, or seizures should be treated with caution. Wet cupping should only be performed where adequate emergency support and patient monitoring facilities are available.